Hi, everyone, and welcome to our Health Talk. My name is Alina, and my pronouns are she and her. On behalf of Patient Education and Engagement Program here at the University Health Network, thank you for watching this session on trans experience in healthcare. At UHN, we strive to provide safe and inclusive care, and that begins by honoring Indigenous peoples. Indigenous peoples are the original inhabitants of this land and for thousands of years have cared for this land. Although we are presenting this health talk in the digital world today, we want to acknowledge and remind ourselves and encourage you to do the same wherever you are currently located, that we are still on the traditional territory of many nations, including the Huron-Wendat, the Haudenosaunee, and the Mississaugas of the Credit River. This territory is governed by the Dish with One Spoon Wampum Belt Treaty, an agreement to share for, care for, and protect the resources around the Great Lakes in peace and respect. Today, this territory is still the home to many Indigenous peoples from across Turtle Island. As we talk today about barriers that trans people face when accessing care within the healthcare system, I will also be reflecting on the barriers Indigenous peoples continue to face in accessing healthcare. How can we work to reduce barriers for Indigenous peoples in accessing Western healthcare and also integrating traditional healthcare into practice? These are some things I encourage you to think about with me. And we are grateful to have the opportunity to work, learn, and play on this territory. Thank you to those who have submitted questions. This helps us see what people are interested in learning most about, allowing our guest speakers to tailor their presentation to the questions being asked, and we will answer some of your questions at the end of the session today. This health talk is also in collaboration with UHN's 2S LGBTQIA+ committee. The committee's priorities are trans rights, cultural safety training, inclusive spaces, and supporting 2SQ+ staff here at UHN. They stand in solidarity with the Indigenous Health Program, Accessibility Advisory Council, Black Legacy Committee, and the Pan-Asian Committee. We at Patient Education and Engagement are excited to collaborate with the committee for this topic. So with that, I'd like to take a moment to introduce you to our moderator and speakers for today. Our moderator, Jason Dixon, is a proud and out member of Team UHN for 20 years and a member of the 2S LGBTQIA+ committee. Jason believes in philanthropy and volunteers his time to serving community organizations that support marginalized populations and to help give safe, positive spaces. Our patient guest speaker today is Kylie Fitzmantle, a multimedia artist, Twitch streamer, and trans woman living here in Toronto. An optical expert by day and a performer by night, Kylie has produced and performed in many live shows around the city and beyond, often centering her art around the lived transgender experience. She likes long walks on the beach, cats, and a variety of violent video games. Next, Dr. Ian Armstrong is a family doctor with a clinical focus on gender-affirming care, sexual health, and HIV. He completed medical training in Edmonton, Hamilton, and Toronto, and now practices in downtown Toronto. And finally, Tessa Ringer is a queer trans femme emergency physician at Toronto General Hospital, Toronto Western Hospital, and Northumberland Hills Hospital in Cobourg, Ontario. She's the medical director of the Myrna Daniels Seniors Emergency Medicine Center at UHN and assistant professor at the University of Toronto. We have a wonderful group of panelists today, so I will hand it over now to Jason to start us off.
Thanks, Alina. Today, our speakers will talk about 4 main themes that discuss gender-affirming care, barriers that trans people face, and how the healthcare system and general population can support someone who's trans. So I'm going to get each of our panelists to tell us a little about themselves and why the topic of trans experience in healthcare is important to them. I'll start with Kylie.
Hi, everybody. My name is Kylie. I am 30 years old, and I am a transgender woman. I've been living the transgender fantasy life for a little while now. I think I'm at day 534 of HRT, although I have been, socially transitioned for a little bit. So of course, this stuff is very important to me. I am walking the walk every day and, being able to participate in stuff like this where we can be open and talk about it and work towards like improving healthcare is great. That helps out all my sisters, all my trans siblings. So I'm on board. I love it. This is great.
Perfect. Okay, next we'll turn it over to Ian.
All right, thanks. Yeah, so I guess I come to this as a family doctor who has sort of a focus with my practice. And really, like years ago, when I went into medical school as a queer person, I was sort of like a sponge trying to absorb as much as I could about medicine, about the healthcare system, and about different people's experiences within healthcare. And the more that I learned and saw, that it really stuck out to me that there was this need for gender affirming care that wasn't really being met, and that trans people specifically seem to have a bit of a harder go at accessing the healthcare that they needed compared to other groups. So it's seemed like a sort of natural area for me to go into. And I chose to be a family doctor because I really like being a constant in people's lives, that I can sort of follow them through different seasons of their life and help them navigating different parts of the healthcare system, which can be really rewarding.
Thank you so much for sharing. And we'll turn it over to Tessa.
Hi there, I'm Tessa Ringer. I'm a queer trans femme emergency physician in Toronto and Cobourg, Ontario. And my interest in trans affirming and gender affirming care grows out of, first of all, my own experience as a trans woman, but also working in the emergency department. I see trans patients all the time. And sometimes they come in with things that are relevant to their gender identity and their gender experience, and sometimes they're not. But regardless of the circumstance, I'm very aware and I see firsthand the adversity that people experience in accessing care. And as an emergency physician, I get to see both the tragedy and the triumph of people's experiences. And so I want to emphasize that in addition to the barriers that trans people face in healthcare, gender affirming care can really be transformative in people's lives and can really be actually a really, really positive force for people as well. So I'm happy to share my experiences on sort of both sides of the stretcher.
Thank you so much, Tessa. I'm really excited. This panel has a lot of experience and information to provide. So we're going to get into our questions. We're going to start with Kylie first. Kylie, the healthcare system can be very challenging to navigate through. What are barriers trans people face in accessing any healthcare?
Okay, first of all, I just need to say, Tessa, both sides of the, what was the thing that you said? Both sides of the stretcher or something like that? I loved that phrase. That was so much fun. But I digress. Okay, I feel like a really easy one that we definitely need to talk about is the inconsistency in how chosen names are handled in medical spaces. Okay. So I feel like in a lot of spaces, it like can be pretty easy to use something like a nickname or a chosen name or however that may look. But that name that you have may be very different than your birth name or your dead name. And like different medical facilities or whatever you're trying to access just are not consistent in the way that they approach that stuff. Some places that I go to are very strict on what it says on my health card, and some places are actually a little more open about it. I get to let you know what my name is. I get to fill it out on a little form and stuff like that. And while that's fabulous, that inconsistency I have found can definitely complicate things. I mean, like I know in the past I've had my blood work get lost because I had a double file. I had two files. I had one that had the name that was on my health card, and then I had one that was my chosen name. And it's lovely that the nurse who took me in wanted to use the name that I've chosen to live my life with, but because it wasn't the same for everybody, it resulted in this whole thing, and then my healthcare gets delayed. And obviously that's not ideal. So that can definitely be a barrier in terms of just like keeping things smooth and easy and like being able to access stuff consistently. I think another sort of like kind of tacking on to this is like, I guess the issue of clockability with that. Clockability, for anyone who may not know, is like being able to be identified as transgender by other people. Okay. I don't always want to get clocked. It's just not everybody's business. But when we have a situation where, again, it's kind of different for every medical facility, I may have a very well-meaning doctor who comes out with their little charts and they say, hey, boy name, we're ready to take you in the back with us. Come on in. And that's that. It's mortifying in the moment sometimes. Everybody in this room knows your tea now. And sometimes, regrettably, it's not like the safest thing either. There are people who don't like trans people for whatever their personal reasons may be, and they don't need to know my truth. You know what I mean? It's almost like a patient confidentiality thing, but they wouldn't even know that it is up front. So yeah, I think that's something that we might face.
Yeah, no, thank you so much for sharing. And maybe can you just kind of tell everyone, like, the importance of, once you've transitioned that name, the impact maybe that has when you are being called by that dead name that you no longer use?
Of course. I mean, part of it is definitely just like respect. You know, I'm Kylie, and that's what I'm letting you know. And like, that's what I just should be referred to in the ideal situation, you know? I think it's honestly as simple as that.
Absolutely. Okay, perfect. Thank you. So I'm going to bring Ian into the conversation now. So Ian, same question. The healthcare system can be very challenging to navigate through. What are barriers trans people face in accessing any healthcare?
Yeah, I wanted to echo what Kylie said, since I definitely see that like the way that like names are used, whether that's in referral forms or prescriptions or lab requisitions, or like just going into the hospital and showing your health card, that it's pretty inconsistent, and it can really make people not want to seek care or not want to get tests done. I think I also see a lot of lack of knowledge, where because most training programs don't teach very much about transgender care, that a lot of doctors don't feel that they're able to provide that or don't feel comfortable with it, and so might send someone to a specialist that has like a 6 to 9 month wait list, or might not have any ideas of where to send someone who needs that type of care. I think that there can be some other types of barriers around sometimes, not for all trans people, but for some trans folks, there can be barriers related to socioeconomic status. I think that often when we sort of look at statistics, trans folks are more educated but underemployed compared to other people, just from difficulties with maybe job interviews or encountering stigma in the job market. And so things like transportation to appointments, or being able to take time off and go to appointments, or like miss a shift for something like that, can be an extra barrier. And then lastly, I think that Kylie also alluded to sometimes the biases that people have, whether that's the other patients in the waiting room, or healthcare professionals that might have their own ideas about what trans people are like, and that can sometimes make it really hard for people who are quite vulnerable when they're seeking medical care and needing to receive care, and sometimes encountering healthcare professionals that aren't always friendly or cooperative.
Thank you so much for highlighting that. Okay, now let's bring in Tessa, who will give us a perspective from kind of both sides of the coin here. So again, Tessa, the healthcare system can be very challenging to navigate through. What are barriers trans people face in accessing any healthcare?
There's so many. I mean, I guess what I would start with is something as simple as getting access to someone who can prescribe HRT. It's always surprising to me when I reached out to my own family physician and said, "Do you prescribe HRT?" She said, "No, I don't do that." And I was kind of taken aback, because for many of us, HRT is like 2 medications. We're on a stable dose for many years. It never changes. Not all of us get regular lab work. It's quite simple. And yet family physicians will prescribe insulin for diabetics that has to be adjusted like every 3 months. And like, I think it's much more complicated to prescribe insulin than it is to prescribe a T blocker and estrogen. But people really see it as very daunting and overwhelming, and not all providers are willing to educate themselves about it. The other thing I would say too is that geography really matters too. So for example, like I live in downtown Toronto, I'm educated, I have lots of friends in medicine. Me accessing gender affirming care was really easy. I just texted somebody and said, do you do this? They're like, yep, I do it. And it was really that simple to get connected with someone. But when I work rurally, people really do not know how to get even started with it. The other thing too is that often the family physician is like a member of the community and knows everybody, and people kind of know each other. And so, you don't have that kind of privacy through anonymity, as it were. And then, I mean, something I see a lot too are a lot of trans people move to the big city because they're moving from smaller communities where there's no one else like us. And they come here and their prescriber is back, in Newfoundland or Nova Scotia or rural Ontario, and they don't have a family doctor here. So they have no one local to prescribe their medication. And sometimes they lose touch with their physician, or they don't get OHIP, and they have no access to gender affirming care. Another really big barrier, I think, too, is that sometimes being trans is relevant to your care, but sometimes it's not. And for example, if I come to the emergency department, I've cut my finger, the fact that I'm on HRT or that I'm not a born woman is completely irrelevant to what I'm there with. And I think if someone sees that on the chart and is sort of taken aback and fixates on it, there's no reason for that to even come up in conversation. Use my name, use my pronouns, address me correctly, ask me how I like to be addressed, and then just treat me like any other patient, because honestly, the fact that I'm trans has no bearing on the care that you're providing. I would also say too that it's not just gender affirming care sort of as such that can be challenging. It's accessing mental health care, addictions care, and other things where the person providing it has sensitivity to the new issues that trans people face. They understand what it is to be discriminated against. They understand the experience of transitioning. They understand what it's like to be gender questioning. So it's not just getting your hormones and getting your surgery. It's all those other things that we need to get good healthcare in this country, and being trans comes up all the time. I guess the other thing I would say too, a little bit in sort of calling back to what Kylie mentioned about names, is like, when you come to the emergency department, it's not the first thing you're doing that day. Like, you're getting up in the morning, you're living your life, you're walking out of your apartment, you're getting in your elevator, you're going down, you're walking down the street, you're going to a store or whatever, you're on the TTC. And along the way, you're experiencing all kinds of micro and macro aggressions. People are clocking you, they're giving you strange looks, they might be sort of overly solicitous and saying things that are like making you feel self-conscious, even in a good way. And you're in a waiting room with people who may not make you feel very comfortable. And then you see the physician or the provider, and then they use the wrong name. And it's kind of just like, there's a lot leading up to that moment. And so it's not just that you misgendered me that moment, and that's the only time it's happened to me today. That could be the 20th or 21st time it's happened to me that day. But on the flip side, what I would say is, if you address me respectfully, you use my pronouns, and you're sensitive towards me, and you handle me being trans in an appropriate way, that can be like a highlight of my day, because that can turn my day around and make me feel, okay, well, at least here I'm accepted. So there's sort of two sides to the coin. So these are just some of my thoughts on the barriers to accessing gender affirming care.
Great. Thank you so much for that. Thank you all for sharing, especially a topic that is pretty sensitive and can probably bring up a lot of trauma and pain for people, reliving those experiences. So I think very important to help us let people see the impact of what they're doing when they accidentally, I don't necessarily think people always show up to do the wrong things, but I think it's so important to highlight the opportunities we have, especially in healthcare, to help better serve our patients. So with that being said, I'm going to turn this question over to Ian. So for those who may not know, what is gender affirming care? What care falls in this? And why does gender affirming care matter? And what may be some barriers trans people face accessing gender affirming care?
Yeah, so I would say that many, but not all, trans people would sort of seek out medical care to feel more at home in their bodies, and also to help the people around them to see them for who they really are. And that can include things like hormone therapy, or HRT, as it's called, which can cause some physical and psychological or emotional changes, as well as sometimes surgeries. I would also consider things like voice coaching or hair removal to be gender affirming care, although they don't sort of typically fall under the umbrella of medicine here in Ontario. And just to speak a bit more about that, when I say people want to feel more at home in their bodies, what I mean is that many trans people feel like there's a sort of mismatch between how their body is and how they see themselves, which can cause an awful lot of distress and discomfort. That we do see that improve when someone is on hormones and is sort of having a more comfortable balance of hormones in their bodies. And I think it's also really important for helping other people around them to see them. That can include helping, like if there are changes in the body, that let their family members and friends to sort of see them for who they really are. And also just people on the street might, it can be a safety matter that people are sort of getting, either not getting recognized as trans if they're sort of looking the way that they want to, and so in some cases safe from harassment because of that. So I would say that the importance of gender affirming care is that it can really sort of heal that mismatch between how someone looks and how they see themselves, as well as sort of the social dimension of it. That being said, there are some pretty significant barriers, which we've touched on a little bit already, with a lack of training for many family doctors and healthcare providers, and so a lack of comfort with that. I think that a lot of doctors have a limited time that they have sort of available to them for pursuing their own training, and so I guess really doctors have a choice of what to do for their continuing training, what conferences or workshops or guidelines to go to, since we can't do it all. But in some cases that can mean that the family doctor that someone already has, or family doctor that someone is approaching, might not be comfortable or willing to provide that type of care. And I think that there can also be, for when it comes to surgeries, obviously that has to be done by a surgeon, by a specialist. And often because there's such a limited number of surgeons doing that, the wait times can be quite long. The paperwork can be a lot very daunting to sort of jump through hoops to qualify for funding. And so that can also be a place where there are like pitfalls and spaces to fall through the cracks.
Perfect, thank you. Now, Tessa, I'm going to ask you the same question, but I'm going to bring in, because you touched on, I think, an important piece about the intersectionality of trans people and the fact that they might be experiencing other things, addiction, lack of employment. So when you're talking about what is gender affirming care and what care falls into that, can you maybe talk about some of the barriers you see coming into the ED for trans people and that kind of intersectionality, how we're seeing the system fail them more than just from one lens?
I mean, I think I would, first of all, I think this harkens back a little bit to what Ian was saying, which is the trans experience is really diverse. Like everybody experiences being trans differently. And people have different objectives in terms of what their ideal presentation looks like. That can change over time. Some people don't really know and they're figuring it out as they go. Some people are gender fluid. Like when we talk about gender diverse people, it's a huge group of people, and it's really hard to generalize. And you're also talking about people who are different in all of the same ways everyone else is different, right? Ethnicity, class background, education, personality, family of origin, all those kinds of other things as well. And so that all has a bearing on like what people need. And I guess I would also say too, that there's a lot of narratives about what it means like to be trans enough and like who counts as trans. And I think for a long time there was this narrative of, well, you have to feel like you're trapped in the wrong body, and you have to look at your body and feel profound dysphoria. And you have to have kind of always known. And there was even a belief at one time that if you were not attracted to men, you could not be a real trans woman, because by definition, trans women were men who were attracted to men who then transitioned to being female. And of course, we know that's very much not true. And so a lot of those assumptions can be very damaging, and it can lead for it to be hard to people to figure out even what it is that they need. And so I think that, for me, gender affirming care in the emergency department, I mean, I have a very limited time to work with people, right? Like even the most complicated patients don't get hours of my time. I wish they could, but that's just not the world we live in. And I have to balance everyone's needs. But for me, gender affirming care in the emergency department will basically just be asking stuff like, I mean, feeling people out and being like, is their gender identity relevant? Is this part of the story here? And if it's clear that it is, or they raise it, I'll say, like, how are you doing? Like, are you just moved here? You're trans. Do you know any other trans people? Do you have a community? Are you safe in your relationship? And then sometimes people will disclose things. They'll say, you know what, it's really, really hard. I want to change my legal name, but my family won't give me my birth certificate. So I can't legally change my name, and it's making it really hard for me. Or people will sort of say, I'm in an abusive relationship, or I'm having to support myself through sex work, and I don't really want to be doing that. And things will kind of come out. And then to me, gender affirming care basically just means like providing people the same care I provide everyone, but doing it in a way that responds to their particular needs. I will say, like, there are certain things that I think are common to trans people, and I do think accessing hormonal replacement therapy, if that's what people want, is a challenge. I think accessing all the other gender affirming things, like Ian mentioned, is really hard too. Like, it's always a little troubling to me that the government will pay for vaginoplasty or phalloplasty, meaning someone to change their genitals to match their preferred gender, but they won't pay for like facial laser. Well, for many of us, having facial hair is actually much more troubling than having a particular set of genitals, and that actually really makes it harder for us to pass and feel good about ourselves. But the government doesn't pay for laser. The government will not pay for breast augmentation for trans women unless they meet very narrow criteria. And when I talk to my trans friends, like, surgery is something that's either in the future or it's not, or I don't really know. But like, we do talk about like getting makeup, getting hair, getting laser, getting, cosmetic procedures to look more feminine. And none of those things are covered. And my view is gender affirming care embraces a lot more. And it really says a lot too, that our society will pay for changes in genitals than all these other things. Because what it means is that our society really fixates on trans people as people with genitals that don't match their assigned sex at birth. And I think that's really damaging and really incorrect. That's my perspective.
Thank you so much for that. And thank you for highlighting. I think it's important for people to understand that, as much as healthcare institutes want to do better for trans patients, sometimes we are kind of beholden to what the government has agreed to or allows for the hospital to bill. So I think very important. Kyla, I'm going to bring you in. So for you, can you give us the perspective of what is gender affirming care for you? What kind of care you would hope that would fall into that kind of category, and what are some barriers that you faced trying to access the care?
Yeah. So I mean, for me at least, gender affirming care is any kind of I guess medical care, be it, or like whatever it may be, that affirms my like true identity, that is going to affirm my true gender. So definitely kind of pulling on what has previously been said already, but like, for me that might look like a boob job. A lot of women have boobs, and a lot of women have really nice boobs, and I want them, it's just a really, for me at least, in my transition, I find that very, very important. Something like that is going to help to cure my dysphoria, obviously when I look in the mirror, it may not line up with exactly what my brain understands to be like the true nature of what my body should be or should have been, or XYZ. And again, that's just my experience. But like having that kind of stuff really helps. And it could also look like, again, like Tessa said, it could be laser. I know I'm paying for laser right now, and it has changed the quality of my life. Like, I feel like, within medical, we really need to understand the psychological impacts of what these things can do, because they may feel very surface level and they might feel like it's very cosmetic, but again, like the psychological impact that that has on the quality of life that we get to live as trans people is just astronomical. It cannot be underestimated how important it is, you know? Um sorry, I'm like looking at my thing. Definitely though, I think again, I know we've already said it, but a barrier that we're all going to face with this is that, yeah, this all costs money, you know? And of course, like, it looks or is deemed cosmetic by other people. So my insurance company doesn't want to pay for those things because they think it's superficial. And the government of Ontario doesn't want to pay for those things. And like, respectfully, I don't have $50,000 to travel to Thailand and get the vagina of my dreams. I just don't. It's just out of reach. So I have to accept in my life that that's just something I probably will never have, you know? So it'd be nice to have the other stuff helped out a little bit so I can at least reduce reduce the amount of dysphoria I have to deal with, you know?
Absolutely. Thank you for sharing. And it
Yeah.
definitely sounds like the barriers do create that added pressure to the dysphoria you already have, if I'm hearing you correctly.
It adds a lot to it, and it's like it's very it's stressful going through all of this stuff. There is a lot of stigma against it. And like sometimes even from the doctors, like I might go get a boob job and like the surgeon who's gonna do that for me might not, you know, support that kind of lifestyle. And that's so uncomfortable for me being like, great, I'm about to go under anesthesia and like trust you with my life to do this thing that's gonna help me. And that's terrifying, again, on top of the wait times that we have to deal with. I know, again, for myself, I'm looking at various surgeries and everything is like 2025 and beyond. And TikTok, I'm 30. I realized I was transgender later in life, you know? I want to get that done. But what are you gonna do?
No, 100%. And definitely, I was going to say, it sounds like COVID obviously has impacted gender affirming care as well as every other facet of the healthcare system.
Yes, yes, it did. I think a lot of us honestly spent, I mean, I don't know about anyone else, but for me, I know I definitely spent COVID locked away in a basement, thinking about the apocalypse, trying on bras and realizing I need this. This is going to change my life. And I was correct.
Sometimes it's, the little big things.
The little big things. Well, yes.
Okay, so I love talking about opportunities that the healthcare system has, but I also like to bring to the table some steps that perhaps the healthcare system can take from all of your perspectives. So Tessa, I'm going to start with you. What are some actionable steps the healthcare system can move towards trans supportive care?
Well, I think Kylie and Ian have already surfaced a lot of really important things. I mean, I think the system should expand its definition of gender affirming care to include things that affect people's ability to live and participate in society and pass, because frankly, facial laser is more important to passing on a day-to-day basis and getting employment than having vaginoplasty or phalloplasty, right? So if you're talking about things that will improve the mental health and the ability of trans people to participate in society, those things should really be considered. That's my strong opinion. But those are really kind of moonshot long-term goals, and how we get there is really challenging. So in terms of really practical things, I mean, I guess what I would say is if you are a primary care provider, you don't necessarily have to get comfortable prescribing every HRT regimen under the sun. You don't need to know every possibility. But if someone comes to you and says, I'm already taking spironolactone and estrogen, and I've been on this dose for 5 years, like just refill the prescription. You don't need to refer them to an endocrinologist. Don't freak out, don't exceptionalize it. It's trans people understand their health, they understand their needs, they know their prescription history. And so, at a bare minimum, continue it. If you're not comfortable and you don't have the time to learn all about it, which I completely understand because I know how overworked family physicians are, know some people that you can refer people to, like know somebody who does provide gender affirming care and have a relationship with that person and know who you can send people to. And also, know about other resources, community groups, mental health providers who have comfort and experience working with gender diverse people, and just sort of know what's out there, because those little things can make a big difference. We talked about all the things that, like names and all the rest of it. But I do think it's small nudges. Like one thing that I see is sometimes how like medical records will have someone's name will appear and their preferred name will appear, but it'll be in quotes. And it's almost like backhanded. It's like, okay, we know this is your name, but like kind of. And it's like it almost is worse. It's like my preferred name's there, but you're kind of like sort of calling into question and kind of being winky about it, even if it's not intentional. And that doesn't feel very good. So those are things where you can just talk to your IT service and say, hey, can we like change that? Can we like get rid of that? And when you do notice someone's name is incorrect in a chart or their pronouns are incorrect, like just ask the clerk to fix it. Like just, do that housekeeping. It can be really beneficial. And I think honestly, like I said before, trans people are as different from one another as trans people as a whole are different from non-trans people. And I think the best way to get comfortable providing gender affirming care is to meet a lot of gender diverse people and hear a lot of stories. I mean, I came out even later in life than you did, Kylie. I was middle aged and was a parent when I came out. For me, a lot of the narratives that I heard growing up and as a younger adult just really rang false. Like what people were saying about being trans, like it just did not resonate with me at all. And it wasn't until a lot later that I heard more and more trans voices. And I said, you know what? People are talking a lot more about like, their boring lives as a trans person. They're talking a lot more about their feelings. They're talking more about their triumphs and the positive side of it. And then I'm like, oh, well, this resonates with me. And I understood it better. And that led to my own self-discovery. So I think the power of hearing narratives and hearing other voices and hearing stories really cannot be understated, because how do you convey something as complicated as someone's gender journey in a pamphlet, right? You can get the gist of it, but like at the end of the day, you really need to hear people and you need to listen to their voices and get comfortable with that and just expose yourself to it. Because honestly, it really is, it's such a rich part of human experience, and gender is something that I think all of us should probably be more aware of, even if we're not trans, but that's just my perspective.
Thank you. And also, I want to touch on something I think you said for the previous question, the way you approach not thinking that everyone is coming for something that needs to be gender affirming. And I think that's really important. I do hear from my trans friends that, like when I go to the doctor, I don't always want to have to kind of live my whole trans journey every time, to your point, like something as simple as a paper cut. So I just want to highlight that again, because I think that's so important for providers to really just take that moment to cognizantly think, do they even want to talk about this today, and kind of make that call based on what they're presenting with.
If I could maybe just build one point on, so like my own experience as an emergency provider, there's more education coming out for emergency physicians about gender affirming care, but a really common topic is trans emergencies. And it's like these emergency problems that trans people experience, and it's complications from like people tucking their testes, or people binding their breasts too tight, or having a blood clot from estrogen. And I'm like, these are really rare and really unusual, and we know how to deal with them through the normal ways we deal with these emergencies. So like, instead of spending an hour talking about all the crazy, unusual, very weird and uncommon stuff that happens to trans people, spend the time talking about day-to-day stuff that really matters for trans people and you can actually do to help people. Because the truth of the matter is, if you talk about all these crazy things, like it really does exceptionalize trans people. It really makes it sound like we're doing this incredibly dangerous thing to ourselves, and like we're really not. So there's a lot of better topics to focus on than these weird emergency complications. So that's just my kind of soapbox as a trans emerge provider.
I think those are important things for people to really kind of think about as we move forward, especially, as trans awareness becomes a much bigger thing. Kylie, I'm going to turn it over to you. What actionable steps do you see that the healthcare system can make to better support you as a trans patient?
Everything Tessa just said was absolutely perfect. That was an award-winning answer. That whole thing. I really want to quickly build on the last thing that you just said, where, yeah, this like the framing of the like trans emergency, the like, oh my God, she's got like an estrogen blood clot. It's like, no, it's just a blood clot. Figure it out. You have testicular torsion. Great. Stunning. It doesn't have to be this big. She's a this. Oh my God. Like, drop it. You know, we are people, we are humans, and like it needs to be humanized. You know, I'm just a patient. That's it. I really sorry. I just needed to like talk about that. I think that's such an actionable step, is really humanizing what this is, what this experience is like. It's a condition, it's a thing, just like anything else. Pretend I have eczema. You know, it's the same thing. It really damn is. But I digress. Another thing, and again, I know I talked about it in the first question, but like, let me choose my name. For the love of God, let me identify myself. It's so simple. You don't even have to speak. You simply have to listen to what I am informing you. And I, as a patient, no, I'm going to let you know this is who I am and this is what's happening. And how can you help me? You know, you don't need to kind of overwrite that for me by making adjustments to my gender marker or my name or XYZ. I think a really like something that like you can do, you, the viewer, could do right now, is, especially if you're someone who like works in like healthcare industry, I want you to look at the software that you are using, because I know all of us are using some really insane, complicated stuff on our computers to deal with all of these patients. If you don't see the appropriate things there, you don't see a marker for an X gender available, if that's something that you're marking, you don't see the options for this is my name, but this is maybe what the health card legal name says here. Send an email to support. Do it today, do it tomorrow. Something as simple as that can actually make a difference, because it's not that hard to update the software. Like it can be done. There are people paid to do that, and they might not know it's a problem because they're not aware of the difficulties that trans people are experiencing. So point that problem out to the right people and help to get that fixed.
I think that's so important. And then I just want to pose one more piece of a question for this. So, you know, a lot of other disease processes, we know that when patients come, they kind of already know, like they do know kind of what's best, what I'm here for. Can you maybe talk about the impact when people make assumptions on, you know, when you're coming to try and get your care, and then, you know, assumptions are made just because you're trans, what that impact might be, and maybe, you know, elaborate so they can understand how to fix it?
I mean, you know, to pull a quote from The Simpsons, you know, when you assume, you make an ass of you and me. Um, don't make assumptions when I'm informing you of like what the truth of the situation is for that kind of stuff. I know in the past, again, I had someone who made assumptions about the way that I wanted my like gender markers to be on my cards when I was getting all my COVID vaccines, actually. And it was this whole thing where it was like, it was a nurse who again was just very supportive and like lovely and wonderful and like wanted to do her best thing. But I don't want my gender marker changed right now. I want it to be the way that it is, because that's just what works for me and what I feel comfortable with as I access healthcare. And like, you know, having that little swap on there again makes things difficult. Things don't line up because one person made a change without asking me. They made an assumption I would want that. And while it's very admirable, ask. Just ask.
Thank you. I think that is probably one of the most important things. And now I'm going to turn it over to Ian, especially on the ask from a primary provider perspective. What are some steps you think that the system can take to move towards trans supportive care?
I mean, I think echoing what the other panelists have already spoken, I think there's a lot to work with already there. I think that as a family doctor, one of the things that I try to balance is that I know that there are certain things that a lot of trans people sort of seek, especially when they're sort of taking the step of coming to see a doctor. But not every trans person wants to be on hormones or wants to have surgery or wants to have other things. And so I try to I guess that sometimes if someone has already said that they don't want something, then it can be really irritating to have it sort of brought up again and again. And so I think that sort of giving someone space to express what they need and what they're looking for, but then also letting them lead the conversation and not sort of pushing someone's own ideas about what you think they need. I think that there are so many different dimensions to this about like asking people their name and pronouns and sort of including that in the chart. If there's no place in the chart or the electronic medical record for it, then like Kylie said, to take that up with IT. I think that other types of things, like if someone's goes to see a specialist and then comes back and says that they had a really uncomfortable experience, then sometimes that can mean advocating for them or changing referral patterns or knowing where it's safe to refer someone, where they're likely to be met with understanding and not with hostility. I think that can go a long way. I think in other parts of the healthcare system, like the people who are in charge of training, of like medical school, that I would love it if every family doctor got this training, or primary care nurse practitioner, if this were sort of part of the training for all of the healthcare professionals and not just something that like a niche expert or specialist can provide. And I think that the people who are in charge of sort of decisions about funding and about eligibility for certain types of procedures, both within hospitals and within OHIP, that they have a lot of power to change people's lives.
Thank you for that. Okay, so we've been really focused on how the healthcare system can be better, what providers can do. So this next question, it's going to be, what are actions someone can take to support a trans person while they're interacting with the healthcare system? Kylie, I'm going to go to you first. And I'm also going to kind of pose, can you maybe also tell us, if you know someone's coming to an appointment with you, how they can advocate for you? Like, just give us maybe some ideas that as a trans person you'd want someone to support you with.
Yeah, for sure. I mean, a great start there on how to support your trans friends is offer to be there with them. For sure. That's such a big one. Offer to drive them to that appointment. Not all of us live, downtown with easy TTC access, even if TTC tests my patience, to get to where you gotta go, make that easier, reduce the stress. If you are going to be there, if you're going to be in the appointment room and like present, be an emotional support for your friend, but also be ready to, I don't want to say challenge the doctor, but like be ready to really back your friend up when they're like, this is what I think I need. And this is the question that I have. Listen, pay attention, because as a patient, you go in and the doctor is, okay, well, here's what this is, and here's what your results are, and here's what this is, and we're going to do this, and then I'm going to get you here. And it's very emotional. You're very emotionally invested in what's happening because this is your life. So just be present, maybe even take notes for your friend, be ready to be the emotionally disconnected person in the room who can be like, hey, wait a minute, let's talk about that. Hey, let's ask another question about this and get some verification on what that means, how I can achieve that and stuff like that. I know for me, that is hugely, hugely helpful because it's overwhelming. I'm emotional. I'm full of estrogen. Please be my second set of listening ears. I think also trans people, we experience a lot of loneliness, like a lot of loneliness. It is hard out here. And again, depending on your geography, you might not know a lot of trans people. Even on the internet, you might not be able to find the people that you really vibe with. So really just like offering that companionship while we go through that is so helpful and so appreciated.
I think it's such an important point, and maybe we can take a minute to kind of elaborate, because I think a lot of people have a misunderstanding when it comes to the 2S LGBT plus community, thinking that we all are kind of this big happy family that supports everyone. So can you maybe kind of explain to everyone how fitting into the community as a trans person, what that looks like, so that people understand that, you know, it's not as all rainbows and sunshine as you would hope.
Yeah, it is definitely not all rainbows and sunshine with that. Again, from my personal experience as a trans woman, it can be really difficult. Like, yeah, you know, I get the little T letter or whatever, but like, it can be difficult to find physical spaces to meet other queers and actually connect. I don't really fit into the gay male space. I can't just go down to Woody's and pretend like I'm gonna have a great time. They don't want, you know, it's like half of them don't feel that I suit there because I'm not a man. But then the other half of them, you know, don't really believe that I'm a woman. I'm like this weird in between thing. And so they might not, you know, want to deal with that. I like don't know what my place is if I'm going to go to a dyke bar, you know, like, yeah, sure. A lot of it might be cool, but not all of it is going to be, regretfully. So it's really not, I think, as easy, because people kind of other us. We're treated a little bit as, I don't want to say freaks, but like freaks. Do you know what I mean? Like it's very, it can be really othered. Yeah.
Yeah, so absolutely. So what I'm hearing, definitely, if you basically a big message out of this question would be, if you know a trans person, just offer to even just drive them and then let them make that call, whether or
Be
not they need
nice.
to keep going further.
Yes. Be a friend. Even if you don't understand all of this stuff, because let's be real, not all of us understand all of this stuff. We are learning and we are researching. I mean, a lot of the times we're responsible for our own research on this stuff. Again, like I'm pursuing some like surgical treatments, and I was not aware that when I showed up to this appointment to talk about it, I was expected to know the name of my surgeon and exactly the thing I want to do and exactly all this stuff. And like that is days and days and weeks of research and stuff like that. So like, yeah, please just like be a friend, be good to us, help me do research, help send me links, please, for the love of God, drive me there and buy me a coffee. Like I cannot underestimate how much we need that.
No, thank you. Thanks for sharing. Okay, Tessa, I'm going to bring you into this question. So again, the main question, what are actions someone can take to support a trans person while they're interacting with the healthcare system? And I'm going to throw to you, maybe what are some things you think doctors could do to be more supportive, especially if they're witnessing transphobia or something like that in their area from a colleague?
So, I mean, I think it's complicated, right? Because the fact of the matter is, like, not every trans person wants to be the trans voice in their organization, and not everyone wants to do that unpaid labor of educating people about how to provide gender affirming care. Not everyone feels comfortable doing that. I do, but I also have a lot of authority and a lot of privilege, and I'm lucky to work at an organization that's incredibly supportive. My colleagues are across the board wonderful and supportive of me, and my work is a very safe space for me. So, you know, not everyone needs to or should have to do that work. So I would say, you know, when you see something, like, just don't wait for the trans person to speak up and say something about it. Like, they may not want to, and if they don't say something about it, doesn't mean it doesn't mean it's okay. They may just not want to fight that battle that day, and they may just not want to take that work on because they're just dealing with the day-to-day stuff like anyone else is, and also the additional stuff that comes with being trans. I think that when you see someone experience transphobia, like, just go up to them afterwards and say, "Are you okay? Like, that was awful. I'm so sorry that happened to you. Are you okay?" And sort of, you know, just be like a normal, good person to them and do all the things you would do to support somebody who experienced something really painful. And then I think asking how people are doing, checking in with people when you know that they're experiencing a transition, like, just understand that it's challenging. But then I think also, honestly, just like including people in everything, and integrating people. One of the most touching things that I experienced is when I came out as as a trans woman, my female physician colleagues, who by the way are like some of the loveliest people on the planet and are all like very, very dear friends now, they invited me to join like their discussion group about like for the other female physicians. And it was just this little thing, but it's like, you're one of us now, you're part of this now. I was like, oh, this is great. Like, I'm in this female space now. I feel very comfortable. I feel very welcome. And it had nothing, there's nothing like trans specific about it. It's kind of, it's more like you're a woman and like you are comfortable and you should be welcome here. And then I think also consider giving to a charity focused on supporting LGBTQ people in general and trans people in particular. Like there are a lot of really good programs out there. Friends of Ruby is an organization focused on to LGBTQ S plus youth, and it's a really valuable organization. It does a lot of great work. There's the 519. There's lots of other organizations you can give to and support. You know, that's basically it. And just be a human being, be a nice person, like treat people with dignity and respect, like just, and don't let your awkwardness and your lack of comfort with pronouns stand in the way of having a conversation with somebody. If you come to me with a good intention and a good heart, and you occasionally use the wrong pronouns, I'm not going to hold it against you, because the truth of the matter is you're being a friend, you're being supportive, and you're doing the right things. And if you call me bro or dude or he every once in a while, like I can cope with that. I would much rather that than you ignore me and not interact with me because you're uncomfortable about maybe using the wrong pronouns. Like try to use the right pronouns, but like if you mess up, it's not the end of the world. But that's just how I happen to feel about it.
Right, thank you. Yeah, definitely it sounds like connection is a big thing. And I think you have a very valid point there with the fact that, and this is probably for any marginalized group, right? Like many of us are exhausted having to try and advocate and fight, and just getting to places some days is the battle itself. So I think very, very important point that the person who's experiencing the phobia, the transphobia, the homophobia, whatever, they may not be able in the moment to address it. And I think so important that if you happen to be witnessing that, then you may have to step in, because a lot of times we go into that flight, deer in headlights kind of, oh no, this is happening right now. And already I don't want to say we, sorry, already I know a lot of trans people, they don't even want to be the center spotlight to start. And that causes a lot of anxiety when, you know, someone's thrusting them in the spotlight over something that, you know, they might just, even to them, might not have been a big deal in the moment, but now it's been blown out of proportion. So I think such a valid point. Ian, I'm going to bring you in to talk about, from a provider standpoint, serving trans patients, what are ways you see that someone can take action to better serve them?
I want to say sort of in general that probably the two biggest ingredients are like having openness and time. I think that sort of being open to hearing about what someone is looking for and where they're at, what their needs are. I think Tessa was talking earlier about how much diversity there is between different people's like experience and trajectory with being trans. Some people know early on, some people understand that about themselves later. Some people come into the doctor's office with pages and pages of research and reading that they've done already, and other people just want to know where to start and what to look for. And just being open to meeting people where they're at and to their needs, being open to their feedback about what your like intake form was like, or what the interaction with the secretary was like. Just being like a willing to listen. And then the other part of that is time, that even when someone has the best of intentions, if they, I think often in healthcare, we're crunched for time, maybe we're overtired, if you've been like up for a late shift, we might be hungry or have a full bladder. And I think that naturally we try to sort of make assumptions or take sort of shortcuts or skip over steps if they don't feel as important. Or if there are like people in the waiting room that we're sort of trying to get to the next appointment. But I would say that sort of catching that about ourselves and sort of making sure that we're fully present and that we're giving the person the attention and the care that they need in that moment can really go a long way to helping them in their process.
Perfect, thank you for that. Okay, we're gonna go to some user-submitted questions. So thank you for those who have submitted questions. Our first question that was submitted is, should we really get offended if pronouns are misused by strangers? It can be confusing for them. I'm going to turn that one over to Tessa, considering you actually kind of just spoke about that.
I mean, I don't think it's my place to say how offended any particular person should be by any particular behavior. I mean, everyone feels differently about it. I mean, I can tell you, like, if I've just been misgendered 15 times on my way to work and someone uses my wrong pronouns again, it's like the way I'm going to react to that is really different. Because of, I mean, my job is always providing me with a source of gratitude because I see what other people experience and how much more suffering other people experience than I do. And so I consider myself really lucky and really privileged. And I tend to have a pretty thick skin about those things. But again, like I said, I'm privileged and I'm often encountering people in a position of authority. I guess what I would say is, pronouns aren't the whole ball game. It's just one part of it, but there's so much more to being an ally and being supportive. And I think most trans people are patient and accepting if someone occasionally slips up. If in general we know that the person's well-intentioned and trying and means well. Again, like that is just my perspective. But in a certain circumstance, but I mean, if the waiter calls you sir 3 times in a row, it's like, okay, we need to have a conversation about this because this is feels really bad. Whereas if it's a friend who like occasionally calls me he, like, it's like, I don't like it, but I can live with it. So how offended we should be, I don't know. That's a very personal decision. I honestly really don't know. I can tell you that the things I lose sleep over as a trans person are like, it's not pronouns. It's the state of access to care, it's the political environment, it's the cultural turn against trans people. It's what I experience in terms of the way people look at me, in terms of people not believing us and accusing us of constantly being liars about everything. That's what gets me down, not so much pronouns. So in the hierarchy of things I worry about, pronouns are pretty low, but at the same time, it's kind of like, I don't know. I mean, if you have a name with an unusual spelling and someone repeatedly pronounces your name wrong, like, it's kind of disrespectful, right? And there's a level at which it becomes a form of disrespect. And like, is that disrespect more egregious than any other? I don't really know. But those are sort of my thoughts on that question. Tricky one to answer. I think it's a very individualized experience, but I think people's reactions to it are much different than what we're not out to cancel people for using the wrong pronouns. Like, that's not why we care about pronouns. We're not trying to play a game of gotcha and catch you out for using the wrong pronouns. We're trying to live and be us and like be accepted and be treated normally. So that's not the agenda.
Yeah, no, definitely. So what I'm hearing is it sounds like intent is a big factor into how people would react, and then ownership, right? If they've made a mistake, just owning that and kind of not being awkward, just say, look, sorry, and correct yourself moving forward. Okay, Ian, I'm going to turn this one to you. What are some key phrases, respectful questions we can ask as frontline healthcare workers to better understand the needs of a trans person seeking healthcare?
Yeah, I think that that can look different depending on the setting, but I think that in like a really general way, like if you're meeting someone for the first time, asking about their name and asking about their pronouns. I think that especially since doctors usually sort of write or dictate notes and you're often going to be using someone's pronouns, you want to make sure that you've got that information up front, especially if it's different from the name that's on like their health card or different from like the pronoun that sometimes we assume based on how someone looks. I think that when it comes to sort of phrases, I think just because people have such different needs, that using open-ended questions about sort of what someone's looking for, I think I would usually start the conversation by asking about someone's gender identity, about what word or words fit best for them when they're thinking about who they are, and then sort of asking about what their goals are, like what they envision for themselves. whether that includes medical interventions or not, and if there's anything that I can do as a family doctor to support their gender. I think that sort of open-endedness really gives people room to sort of express what they're looking for, and to feel like I'm not judging them and making assumptions about them.
Perfect, thank you for that. So there was a third question, which was about resources in the community, and we know that Tessa highlighted a couple of them. We are going to provide them in the description box below. We'll try and include as many resources as we possibly can for everyone to have available. So before we go, we're going to have one final question, and for 1 to 2 sentences per our lovely speaker, what's one key takeaway message story you would like people to know from watching today's talk, or what is a key story important message for you? I'll turn it over to Kylie first.
We are human beings having the same but very different human experience as everybody else, and your respect for that experience is so appreciated. Hire trans people for like behind the desk. Get us in there. It makes such a difference to have somebody who can, again, see both sides and point out little things here and there. And like also from like a patient perspective, to have community members, transgendered people who I can receive that kind of healthcare from is so nice. Sometimes, like I know for me, like I do optical. I make glasses. I fill out like glasses prescriptions for people. I help them pick stuff, and like I know that like the trans clients that I have who come through and that I help, they appreciate having someone who's like, I get it. You want to do this. You want to do this. This is the direction. I'm not going to make you feel weird about it. Let's talk about it. Let's try it out. It's just so invaluable.
Perfect. Thank you so much. Tessa, I'll turn it over to you now.
So I would say you would be amazed by the difference you can make by treating someone with dignity and respect. It can go a long way towards changing someone's day and their relationship to healthcare. So never underestimate the power of kindness and decency to anyone, trans people included.
Thank you for that. And Ian?
I guess I would say that gender affirming care is something that's really well established and fairly well researched. I think that even though it hasn't gotten as much research as other topics in medicine, that like hormones have been used for decades. There's been almost 50 years of like expert meetings and association meetings about how best to provide this care. And so this isn't something that's sort of experimental the way it's sometimes painted, but something that's actually very rooted in science and experience and wisdom.
Perfect. So I just want to quickly thank everyone for sharing and being with us today, and I'll turn it back over to Elena.
Thanks, Jason. On behalf of Patient Education Engagement Program here at UHN, I want to extend a sincere thank you to Jason for moderating this important conversation. Thank you, Kylie, Ian, and Tessa, for sharing your expertise and experience in trans access to healthcare and taking part in this important conversation. Finally, for those watching, you're always welcome to contact the Patient and Family Learning Centers at UHN. They offer reliable and up-to-date health information to patients, families, healthcare providers, and members of the public. All their services are free and available in multiple languages. Your feedback is also important to us. You can go to the link on the screen to complete the survey at the end of this video. Your feedback helps us to know what you liked, what we can improve on, and what topics you would like to see in the future. Finally, to keep up to date with our Health Talk, you can subscribe to our patient e-newsletter to get up-to-date information about events and new resources at UHN. And our next Health Talk will be in January on outcomes after critical illness after being in an ICU. You can start submitting what questions you have on the link on your screen. Thanks again for watching, and see you next time.